Today marks 5 years since the World Health Organization declared COVID-19 a pandemic. As we know, the illness killed millions of people worldwide.
CBS's Bradley Blackburn talked to doctors on the front lines of the pandemic in the early days and has one patient's survival story.
In March 2020, when the world locked down, Sal Mazzara remembers the moment he felt symptoms.
Then I had the fever, the cough was persistent, then sweats.
The father of 2 from New York already had a lung condition, so when he struggled to breathe, his wife Josephine drove him to Mount Sinai Hospital.
I could not believe what was going on, that I was just dropping my husband off at the hospital and wasn't sure if we were going to see him again.
This was an epicenter right here.
Yeah, it was.
Critical care doctor Sanam Ahmed remembers when the hospital filled up and tents were set up in Central Park. The city used refrigerated trucks to hold the bodies. While her own 4 children were in lockdown at home, she treated countless patients on the brink of death.
I've never seen so much tragedy in a short period of time.
Sal spent weeks on a ventilator. He needed a tracheotomy and suffered a cardiac arrest. His family couldn't be by his side.
We're probably going to take that trach out.
Dr. Ahmed was.
Sal,
Hi,
how you feeling?
I'm feeling great.
Yeah?
So happy.
If you had a cardiac arrest, it was extremely unlikely that you would survive, and Sal did.
After 45 days, Sal left Mount Sinai to go home.
5 years.
Last week, for the first time since 2020.
Hi, Sal. It's so good to see you.
Hi, nice
you
to
look
see you.
so good.
Yes, thank you.
Doctor
thank you.
and patient met again.
Never forgot you, and I thank you for everything every day.
A family that will never stop saying thank you.
My hero, right here.
Thank you.
And reminding others what it took to survive.
I hope that people remember how everyone supported each other.
Bradley Blackburn, CBS News, New York.
And a Pew Research Center poll shows 6 in 10 Americans say the public health system would do a good job dealing with a future health emergency.